Welcome to the Public Health Millennial Career Stories Podcast, episode number 3. This is the Public Health Millennial Career Stories Podcast, where you'll hear about diverse career stories, career strategies, learn from others, and get tips along the way. If you want to learn about public health careers, self-development, and what it can do for you and the populations around you, then make sure to stay tuned. Today we have someone who's pushed me to continue to do what I do through my Public Millennial blog without her even knowing it. She has overcome adversity during her life to become the great public health professional that she is today. She is the CEO of her business, Your Resource Center, LLC, a self-published author of Tools for Career Success, 101 Answers and for Frequently Asked Questions about Public Health, with her second book on the way. Last but not least, she teaches students and leaders how to market and unleash their value. We have LaTonya Bynum, MPH CHES or CHES. So the quote for today is, "Life begins at the end of your comfort zone" by Neil Donald Walsh. So just think about that as really wanting to push yourself more and do things that are outside of your comfort zone, like this podcast for me, to really grow and learn. So thank you and welcome to the show, LaTonya. How are you doing today?
Yeah, I'm fine. It's such an honor. Like I said, I'm just in awe of your just looking into what I've been working on and you for selecting me for this podcast. So I look forward to the conversation. So thank you for having me.
Yeah, my pleasure. And you're definitely someone that definitely stands out on social media for public health. And I think that that's something that I'm trying to bring more awareness to with this podcast. So thank you so much for being on. So I know these times are very uncertain and things are crazy. So how are you coping during these uncertain times?
Yeah, so I would say, so first of all, I'm here in Conway, Arkansas. I have been when COVID started off, I'm just gonna keep it real. It was like, oh my God, kids are home. I've been telecommuting for about 3 years straight, but it seems like there was a lot of like change all at once.
Mm-hmm.
So at first I was just like, oh my gosh, how can I manage homeschooling, then working and then running
Mm-hmm.
my business? But it once I started like, oh, I'm gonna put my kids on my calendar, it's just like everything start falling in line. So now that it seems like America is about to open back up again, I'm just now finally getting like a consistency about like how to do it all. So just when things are looking like you got it all figured out, it's about to change again. So, but so far so good. How are things in Alaska?
Things are going well. Things have opened back up. I think they're pretty much going to be opened up after this Friday, which
Okay.
is been very interesting situation because they have done a pretty good job of containing the COVID cases. Because I
Mhm.
want to say there are less than 400 cases right now,
Okay.
but the testing is not there, and then the adherence to wearing mask is not there. So if like I'm going to the grocery store tonight and like I bet I'm going to see like 90% of the people not wearing any mask or anything. So that's
Mm-hmm.
kind of like disheartening. But other than
Mm-hmm.
that, things are going well. But I definitely understand what you're saying about the groove and now you're losing it because it is definitely a big change having the kids home and then having to balance all these new things in your life.
Mm-hmm.
So thanks for sharing that. So tell us a little bit about yourself.
Okay, so to tell you a little bit about myself, of course, my name is LaTonya Bynum. I'm in Conway, Arkansas. Um, my public health background is really from working at the Arkansas Department of Health. And right after I graduated with my Bachelor of Science degree in 2004 from the University of Central Arkansas, I didn't really have a lot of experience, so I took on a job as a secretary,
Okay.
just to get my foot in the door at the Arkansas Department of Health. And the only reason why they really hired me, to be honest, Amari, was that I had a Spanish background. So they said, okay, you got a Black woman who speaks Spanish,
Mm-hmm.
like it must be something we can do with her. And thank God for Mr. Ed Carson. He gave me my first opportunity, and he said, LaTonya, if you can speak Spanish, then we know you can learn this thing called SAS programming language. Have you heard of SAS?
Yeah, I've heard of SAS. I haven't used it. I've done SPSS during my master's,
Okay.
but SAS is what a
Uh-huh.
lot of the other people did. Yeah.
Yeah, so that's good. SPSS, SAS, that's all good. So my career really in public health started out as, singing as a secretary. And once I got my foot in the door, I was like, oh, this is good. Like, I was only making $8 an hour, so that's not a lot of money in Arkansas.
Hmm.
So I was like, I was always listening and looking around like, okay, I see these epidemiologists and these statisticians, they're making the most money. So it seems like I need to pivot and say, oh, okay, I'm the go-to resource person for all statisticians and epidemiologists. So just to tell you a little bit about myself, I'm very creative,
Hmm.
curious, always trying to fill a gap. And so from going from being a secretary, moving through the ranks 13 years later at the health department, I was able to go from secretary to senior analyst. And
Okay.
I credit that for just being always open to helping others, and then being willing to go train and retrain on different skill sets that I didn't know about. I have about 16 years of public health experience now. My
Hmm.
day job, now since I've transitioned out of working for the health department in 2017, I left there. But now I'm a technical editor at DXC Technology. And this is a global IT company. But really what I'm doing is the same thing I was doing at the health department, is translating information and data into simple terms. So at the health department, I was working with the epi and the stats folks who were really, talking over people's heads.
Yeah.
And I would
Yeah.
come in and I'd be like, okay, what they said was infant mortality, but what they're really trying to say is a lot of babies didn't make it to their first birthday. And so that was my skill of, like, just kind of like with Spanish, you're translating,
Yeah.
interpreting
Hmm.
what people are saying. And I've taken that and I went from $8 to 25. Now I'm at 30. And I'm very transparent about my salary because I know when I was in school, I always wanted to know, like, who making what and how can I win? Like,
Yeah.
let's
Yeah.
just talk about the money. Like, are you doing
Absolutely.
well, or are you barely making it? So, that $30 an hour in Arkansas, that's pretty good money for a health educator, because oftentimes health educators are undervalued, underpaid, underutilized,
Hmm.
and a lot of times people just don't know what a health educator is. So just a little bit about me. I'm very creative, curious, always into something. And like this podcast, I just get excited about anything new. So my learning curve is always like, what else can I get
Yeah.
into? Yeah,
Yeah.
and you're the same way, I can tell.
Yeah, definitely just on an upward learning trajectory, because I feel like the more you learn, the more that you want to learn. So
That's
I've
true. That's
I've
true.
definitely seen that. So I kind of want to take you back to let's say before, like what really started you thinking about public health, or were you in the secretary position and then public health was there? Like, what's the timeline for that and your bachelor's also?
Yeah, so the story of, so originally when I left for high school, I wanted to be a doctor.
Okay.
I really wanted to be a doctor just because of this fancy title. I wanted to impress my parents. I wanted
Mm-hmm.
to go off to college and be that first generation college student that was just, like everybody's like, oh my God, Tanya's going to college. I just told everybody I was going to be a doctor. So
Mm-hmm.
when I got there, and honestly, I didn't do well in human anatomy and physiology.
Okay.
So that didn't work out for me. I was just like, oh God, like, what am I going to do? So I'd taken all these medical school related courses, and I said, oh, what am I going to do with this? Because I need a degree. I need, like, you just racking up debt if you
Mm-hmm.
don't have a direction or a major. And I
Yeah.
was just like, oh, okay. So my roommate was in the health education, and one of the admission counselors was like, okay, let's look into health education. And health education was my way out. So public health really for me was a second win. I didn't know anything about public health when I graduated, but I knew that when I was in school, I needed to set myself apart. Like,
Mm-hmm.
have your degree, but then also have a specialty. So that's why I coupled health education with Spanish, because I knew everybody's going to have a bachelor's degree, but not everybody was going to have that Spanish background. And so just, marketing myself, it took me about 4 months to actually find a job
Mm-hmm.
after graduating. And really, I didn't know that like people, you should, the work that you're doing is so very important. Just putting people up on game about the applicant tracking system, how to network. It's just some of that stuff I probably just wasn't listening while I was in school, or the career counseling folks. They really just didn't target public health like I needed them to. So I just got on the internet and just started looking at articles and found out about the applicant tracking system. And that's how I finally got my application picked up at the health department in their database.
Okay.
But yeah, it so far, I would say public health has been a blessing. Just working with people, serving in chronic disease programs, learning about how data can change programs and what they're actually working on, and help to inform some of the leaders on like, okay, the data is saying this, so we need to pivot and kind of change how we're doing our activities in the community based on the data. So I mean, I've been in so many things in public health. We could talk all day about me moving from secretary, just a often underutilized gatekeeper type of position, and moving into some of those higher level leadership roles. It's been a journey, to be honest.
Yeah, definitely. And I just want to touch on two things that you said there. The combination of using Spanish and public health to really set yourself apart, that's definitely something that you have to do, especially in today's world where public
Mm-hmm.
health is becoming a lot more competitive. And if you look at a lot of jobs right now, they're asking for Spanish, like preferred. So if that if you do have like a skill set like that, it's definitely a bonus. And
Mm-hmm.
then the other thing I wanted to talk about is definitely you have to be proactive during your search and your journey, because you don't know what is out there until you know what is out there. So
That's
it's
true.
definitely about just looking and learning and going about. And I like that you're transparent about your income, because I think it's something important, especially when so many people are racking up so much debt going to school. Like
Mm-hmm.
you must understand, like, after school, what is the trajectory for paying this off and what are the options. So thank you for talking about that. I wanted to talk to you about something that I know you're big on, and that is the CHES. And
Yes. Oh my
so
God.
tell me about like when you got it, why you got it, and then the experience of having it up to now. Because I know
Yes.
you are like a CHES OG in the game, so
I like that, CHES OG. So CHES, for many of you who might not know, but CHES stands for Certified Health Education Specialist. And I love talking to you, so I can just be honest. But for me, CHES was something that I took right after school because I know that it would set me apart. All my professors were like, LaTonya, this is something that you should really do. It's usually preferred in your job descriptions when you're applying. They really look highly upon this. But actually, I took the exam and failed it by 3 points the first time I took it, because I had all that book knowledge, but I didn't really have like the application of like what you actually do as a health educator. So I
Mhm,
failed it the first time by 3 points, and then I the job that I got as a secretary, it didn't require it. And all the way up until around 2006, when I started publishing papers, I really didn't think about it again. And here was my thinking in 2006. I said, well, I got my bachelor's degree, but I need something else to set me apart, because I know I wasn't
mhm,
going to go back to school. My brain was already hurting from just working and trying to transition out of working 2 jobs, because I was a cashier at Kroger, and I also was working at the health department as a secretary, because you got to make ends meet.
mhm,
So I got to the point where I was like, you know what, if I could take the CHES, then these people, when they see me and I'm published, I'll get more street credibility, and it'll broaden the opportunities that I'll get. So I was publishing papers with a bachelor's degree when I saw all of my peers at the health department, they had masters and doctorates. So I said, this credential is going to set me apart. So that was really the only reason why I took it again and eventually passed it. Not in 2006, but 2011, I took it
okay.
again and passed it. Yep.
Okay.
So,
Okay.
but it started from just me publishing papers and wanting to set myself apart.
Okay. Awesome.
Does
And
that
you,
make sense?
yeah, it completely makes sense, and I think it's a huge certification. It's one that I've been looking into getting.
Okay.
I'm not sure like what path I want to go right now, so it's definitely something that I definitely would advise anyone in the public health, especially health education, to definitely look into. So I know you have another post-bachelorate certificate in public health disparities. So
Mm-hmm.
talk us about that. Like, why do you decide to get that?
Yeah, so so I was working at the health department and they were like, okay, LaTonya, do you want to go to school? And I'm like, well, I'm newly married. I don't know. It's already stressful. I'm trying to keep this job and figure out life as a public health servant because it's a lot of work, to be honest. Public health workers, as you can see, COVID-19, we are doing a lot. Now we're just getting a lot of attention, but that's a whole nother story. But back to what I was saying, I think when I realized what the CHES was going to do for me, and then also, coupling that with a post-baccalaureate certificate in public health, I thought to myself, this is another way to set myself apart from all of my peers. And on top of that, it was a way for me to get in the Masters of Public Health program without taking a GRE. See there? See, so it was really just a trick way of not having to test again. So I went through, registered through SoFast for going to the University of Arkansas for Medical Sciences School, College of Public Health. I just went through their process and I said, well, this post-baccalaureate degree will get me closer into getting my master's degree without getting a GRE. So that's how that program started. Mm-hmm. So
That is really smart.
you gotta look for those waiver programs.
Yeah, well, I've never heard of that. And that's probably a huge benefit and something that a lot of people probably don't know about.
Mm-hmm. You gotta look for the shortcuts.
Well, I'm glad you found that and you
yeah,
utilized it.
yeah. So that's what that was about.
Okay.
As I transitioned in the MPH program.
Yeah, and tell us why do you want to pursue the MPH, and what was your concentration and how was that experience?
Yes. So once again, after I finished the certificate in public health program, I was really confused on, they have 5 different specialties. I'm not gonna name them off the top of my head, but you have different tracks to select from. And I said, well, I work in health statistics. I work with a lot of biostatisticians. I work with epidemiologists. I got a bachelor's degree in health education. And the only thing that I did not know, and remember that learning curve, I'm always trying to learn and strengthen the area that I'm pretty weak in. And so I said, you know what, all of these programs is really about these rules. So I said, I'm going to get an MPH and specialize in health policy and management. And so I worked through for 2012 to 2016 and worked on my master's in public health. And I'm gonna tell you, what's so good about getting the MPH and earning it was I ended up having 2 babies throughout the program. Yes. So
Wow.
I'm gonna tell you, like the amount of stress that you can go through as, I'm working, I'm also a mother, I'm a wife. Like I'm telling y'all, if I can do it in Arkansas, anybody should have confidence to say, you know what, if LaTonya can do it, I can do it too. So you just got to keep pushing and be determined that you're going to get the education so that you can make a better life for you and your family. And that's what it was about for me.
Yeah, that's very inspiring, and I think definitely a lot of people would take that. Like, if 2 kids is a lot, and then 2 kids plus a master's program, I can't even imagine. So I give you a lot of props for that. So congrats and well done.
Yes, thank you.
Yeah, you're welcome. So you graduated from your MPH, and then what was the process for you looking for jobs? And then I know you also started your own company at that time, or well, a little while after your MPH. So talk us through that.
Mm-hmm. And again, I appreciate your research. On the inside, I'm just like, man, you got it all timelined out. So after I got the MPH, shortly after that, I thought to myself, like, okay, what am I gonna do? Like, I knew I wanted to move up, you know, um, but the positions that I wanted were actually not available to me. And that's a whole long story, but I never wanted to manage a team that I really couldn't be myself and really mentor them like I wanted to. And I knew from my past experience that I had seen managers get to the point where they were they had been they people have filed grievances on them because they didn't like the way that they were supervised or didn't get an opportunity. So people were getting upset. And I was like, you know what? I don't want to be a part of that. If I'm going to manage a team and I'm going to lead, it's going to be my own team. And I'm going to talk to them in a way like I would want to be talked to. But, you know, sometimes you have to get personal with people to kind of really connect to them. So at that point, after I got my master's degree, I was like, it's time for me to leave. You know, 13 years, I had followed the way that my mom and dad told me, you know, get a good government job, hang in there, retire from it. I did that, and I said, hey, it's time for me to do my own thing. I'm finna switch up. And so in 2017, I got my first contract with the state of Wyoming, $3,000 public speaking contract, and I started my business in 3 days, and here I am today.
Okay,
it was just time to leave.
Okay, so tell us more about your business. It's focused on public speaking, or what more is there to it?
Yeah, so the name of my business is URA Resource Center, LLC. It is a public health consulting firm where we really focus on 3 of my niche specialties, things that people would always say about me as a cashier or working at the health department. They will always say, LaTonya, you are a resource. Like, I'm like, okay, what am I doing good that you like? People always like how I talk. And I think that comes from me being a cashier, seeing all those random customers come through my line and just, you know, just talking to people in general. So public speaking kind of came natural to me, but then I perfected the talent through ToastMasters International. So public speaking is a niche. Also research, you know, just being nosy basically, but turning that skill into something to publish papers, to look at data. And then the third skill is writing. I enjoy writing. Is really therapy for me. But really my business is focused on those 3 niches because I want to develop that talent in other people. And I know that all of us have strengths, but I'm really focused on health educators, any public health professionals, but students in improving your communication skills, whether it be in writing or presentations, and then also looking at your research skills. Okay. So those are the 3 niches for the business.
Okay, and to walk us through how you got your first customer, the state of Wyoming. Like, what was that process? How did you go from there? Like, how do you reach out for them?
So this is how it happened. So you're gonna do this too. So you know, in your past you've been a referee, so you're watching everything. You kind of sitting and looking. So I was at this conference, and I was sitting there, and I was like, you know what? That lady right there is something about her. Something's telling me that I need to talk to her. And as she walks by, she looks at me and I looked at her and she said, oh, are you here for the conference? And I said, yeah. She said, would you like to do breakfast with me? And I said, sure, I've already eaten, but I can sit here with you. So she just invited me over to her table and we got to talking. We just like, you know how you just instantly connect with people? But I got to telling her, I was like, you know what, you need to know this. Like, I was just giving her everything I wish I would have known, because she had only been in the position for a year, and I had been in my position for 3 years doing the same program for the Office of Rural Health and Primary Care. And so I was just pouring into her, and she said, LaTonya, if you are pouring into me like this, all the stuff that I needed to know when I started, I know you can help my team back in Wyoming. She said, I want you to come to Wyoming. I said, okay. And you know how some people, like, they're really nice and they're like, oh, let's do coffee or let's get together. And I thought it was more of that, like, yeah, thank you for all your information and I appreciate you. And I thought I'd never hear from her again. So I get back and she's like, LaTonya, I have the money. I got $3,000. Do we want to run this? through the company, or do like how you want to do it? And I said, oh no. I said, give me a couple of days and I'm going to get back with you. So in those 3 days, I went and filed for my LLC. I came up with my business. I came up with my business name, then filed for my LLC. I got my tax ID number and set up me a checking account. And I went online and to Google templates and got me like a little invoice and came up with a logo, and I sent it to her and she said, okay, well, come on. I was like, what? So at that point I was like, okay, if I could get $3,000 to speak for 30 minutes, I wonder what else is out here in America. But to use my education, but just sharing with her and pouring into her, she saw that I was so like passionate, but also resourceful, and I wanted to help. And like my will was, I wish somebody would have told me these things, but here, I want you to know this. So that's how I got my first contract, and been getting contracts the same way ever since. It's about putting yourself out there.
Yeah, absolutely. And you see, when you do put yourself out there, good things do come to you. So, wow, that's amazing.
And that's how I ended up in this podcast. Just me writing random thoughts and stuff I wish I would have known. And you were like, oh, okay, if she's doing this, like, I know she probably do good on the podcast too. So here we are, another opportunity.
Absolutely. Yeah. See, you're on the lookout, and as you say, you got to put yourself out there to get out there. So definitely take that tip, everyone, and get out there. Start just contributing in some way to a community. Mm-hmm. Mm-hmm. So I know public speaking is a great transferable skill that a lot of students, I would say, lack. And that's something that you say that you try to develop in people. What is something that what advice would you give someone who is trying to get more confident in public speaking?
Yes, my best advice, I wish somebody would have told me this when I was in high school, really. But ToastMasters International. Have you heard of ToastMasters?
I've heard of it, but I'm not like familiar with it. So I don't know if you definitely just talk more about that.
Yeah. So ToastMasters International is, of course, an international organization where they focus on building your self-confidence in communication and leadership. So they take you through what they call their pathways, which are really a set of speeches designed to help you to develop your story and to share it. But then they also give you tools so that you can do jobs or small tasks, large tasks within the organization during meetings. So you will get an assignment, which is also called a role, a Toastmaster role. So you be Toastmaster of the day, joke master, eye counter. So you have certain positions that will bring out your leadership skills. So I joined in 2014, and to be honest, I had in 2004 is when I first started at the health department, and the same boss, Mr. Ed Carson, he invited me to Toastmasters, but at the time I was like, that's something for white males. Like, what am I go in there for? Like, that's not for me. I just didn't want to go. And I was a secretary because I was like, what am I doing there? Like, that's not for me. So I never joined until fast forward 2014. See, so I missed out 12 years of growth, just because my mind was gone. So I don't want y'all to do that to yourself. So start now. And what I did was I went in with this mindset of, I'm just gonna develop. I'm gonna stop being so nervous when I go to these presentations, because to be honest, when my supervisor told me I had to present, I would get heartburn. I'm a sweater, so I start sweating on my head, my ears would burn. And so, like they say, public speaking is like one of the things like people fear the most. And so I joined in just hearing people's stories and how they spoke, and they would walk around from the lectern and just like move. I was like, I want to be like that. It's inspirational. It's also like a high that you get from just being around motivational, inspirational, energized people. You just pick up on their energy. It just makes you want to do more. And so I joined, and I've been a Toastmaster ever since 2014. Here we are, 2020. I'm still at it.
Okay.
Yeah, but a great organization to be a part of. And if you go to ToastMastersInternational.org and type in your zip code, there's clubs that meet in Alaska, Arkansas, of course, anywhere that your listeners are listening in from. But you can go there and find your nearest club. And what I would say is, not every club you're going to visit is going to be a great fit. So you might want to visit a club if their vibe isn't right. Check out another club, because every club has its own vibe and its own culture or group of people who actually attend. So keep searching and find you a home club. And I'm telling you, like, leadership, communication, but then also opportunities, because you're networking with professionals. And then, I got my first public speaking engagement from just being a Toastmaster. So there's money in it too, opportunities. Yeah.
Okay. Yeah.
So, but yeah, does that make sense about Toastmasters? Do you have questions about? Have you ever heard of Toastmasters in
I've I've
Alaska?
I've heard of it. I haven't heard of it in Alaskan context, but I know it is something to like
Mm-hmm.
better your public speaking and like your confidence and how you put yourself out there. So, and it sounds like a great opportunity in surrounding yourself with people that are trying to be better, and that's always a great place to be because you're going to push
Yes.
yourself.
Mm-hmm.
Okay.
Yeah. Check it out for me and tell me like what you think. If you find a club in Alaska, that would be interesting.
Okay, definitely will do. So I know you spoke about your business has two ideal customers, right? So
Mm-hmm.
so you have the public health professional and then you have the business side. Do you just want to talk about how do you go about trying to get these different customers? What's your
Yeah.
marketing strategies?
So my marketing strategy is social media. 90% of my clients find me through social media. So that first year of business, I just posted consistently on LinkedIn. I started with LinkedIn, and I would just share things that I wish I would have known as a secretary, like train.org, explorehealthcareers.org, like all of these tools and resources that are online that you normally don't get access to until you're in the professional world, which is probably something we need to do more for students. But just sharing online, people would inbox me like, oh my God, tell me more about that, or where I get information. So just going back and forth, I was like, okay, well, all these people need to know this. They're just like me when I was a secretary. So it started with students, then it went into like, oh, the professionals, there's some actual people who are already in public health, have experience, but they're looking to transition, go to a different job, or just transition out of public health altogether, maybe into consulting, starting their own business. So just posting consistently once a day. And at first I was just like, dang, ain't nobody liking my posts. Like, I'm not getting any interaction or engagement. And it seems like the more I was on there, I started getting more likes, more engagement, more inboxes. People start paying me through PayPal. The money started rolling. I was like, this is my real life right here. And so but what the game changer was when I found out about Hootsuite.com. Have you heard of Hootsuite?
I'm not familiar with
Yeah,
Hootsuite.
you gotta get Hootsuite. So, Omar, when you get Hootsuite, it's a scheduling service for social media. So you can link it to your LinkedIn, Instagram,
Mm.
Twitter, and then your Facebook business page. So I linked it up to LinkedIn, Instagram, and my Facebook business page. And so every time I post something, it goes up to all three channels, and I can see the engagement. So there's so many ways to engage and get people interested in your resources, also your story. So as I learn things from my clients, I'll just go in there and just type some nugget like, this is what I learned today. So as I learn, I keep sharing, the business keeps growing. It's just, I don't know. It's a natural, like, you just learn, share, grow. Like, you just, it works like that, if that makes any sense.
Yeah, like I completely understand that. Like, especially starting up, like my blog on my Instagram page, like at first I would get no engagement, and then like I was like, should I just quit? But then I was like, no, let me just keep going, and I
Keep
kept
going.
going, and then like you get the occasional message from someone, and that really like makes you feel good, and then you keep
Yes,
going. yeah, and then it just keeps on building on itself. And I definitely think opportunities open up just from sharing. And as you said, like, you don't even have to create content. Like, as you were learning new things, you just jot it down. So you just
That,
learn something and jot it down. You don't have to
that's
really
all.
think about it, you know.
Yes, that's it. So yeah, it's been working out so far. So good. I can't complain at all. Business is good.
Okay, I'm glad to hear that. So, switching off the business topic, let's talk about your book. So, it is a book that is on my reading list. Unfortunately, and I'm in Alaska, and the pandemic is happening. So,
Hmm.
if I try to order a book, it might come like June, midway through June, so a really long time. And
Hmm.
I'm not sure if I'm going to be here at that point in time. So I was like, I gotta wait until I move to get the
Hmm.
book, but it's definitely on
Hmm.
my reading list. So
Okay, good.
tell us about the book.
So the book came out of my work on social media. So um, so the story goes like this. Really, I got this idea of like, I'm gonna get some help, and I don't know who's gonna help me because good help is hard to find, by the way. But a lady that I did a resume for, her name is Miss Kelcher Chandler. She reached out to me and she was like, "LaTonya, you did such an awesome job on my resume. Do you mind if I intern with you?" And I was like, okay, like my first intern. And think back, like that's why I left the health department, because I didn't want to manage anybody, right? I just want to do my own thing. So I was like, well, honestly, Kelcher, I really don't like managing people. I don't like being over anyone. So I don't know. And she was like, no, I want to learn from you. You're so amazing. So I just kind of was like, okay, I'm gonna take a chance. And one of our projects was to look at my LinkedIn posts wherever there was over 1,000 views or 30 likes or more than 30 comments. So anything that engaged really high, I wanted to compile all that content into a book. So I took all of that content from 27 all the way up into 2019 and put together this book, Tools for Career Success, 101 Frequently Asked Questions About Public Health. And I think, for me, I never thought of myself as a book author. Some people like spend their whole lives. I've always loved to write, but I've never thought I would be writing my own book. But so far it's been going great. Now I'm working on my second book. It's just like once you get into something, everything else, once you start winning, you just like, it's just more. There's more to do, more opportunities. But so far the book has been a blessing to my clients. Everybody who is a client with me who spends over $100, they get a courtesy copy of the book. So with the business, it's just a confirmation to my clients that not only does she believe in herself, I've invested in myself. And then actually when they get the book, they're like, oh my God, if I'm working with somebody who has a book, she's in public health, I'm in public health. Oh my God, like it resonates with their spirit. And they're like, okay, we can do this, LaTonya, let's go. So, after the book came the app, the next book. It's just on and on and on. I'm telling you, it's so much stuff out here for us to get into in public health, Omar.
I feel that same way. I feel like there's so much that can be done, especially in like the social media realm, the website realm. I feel like there's a lot of resources out there, especially for like med school and pharmacy
Yes.
school and dentistry, and public health is up and coming. So there's a lot of opportunity there. So when did you publish the book, and tell me about the self-publishing process, because I'm interested in writing a book, and I just
Oh,
this is something like I kind of wanted to ask you for. I was like, wow, she
yeah.
has a book, and then so
Yeah.
I'm so happy to have you on the podcast to ask these
Yeah,
questions.
I'm gonna tell you. So first of all, thank Kelcher for helping me to compile the content. But once you got the content, slapping it into a Microsoft Word document, making sure you have about 18,000 words or so. But the book was self-published August of no, yeah, August of 2019. The book was actually published through my publisher, Sophisticated Press. Shout out to Miss Renetta. So I thought to myself, I'm good about researching things online and trying to figure it out my own way. And I said, well, no, I have the content. I just need somebody to mentor me through this process. I don't want to get confused. I just want, so I invested in myself, reached out to her. I did a Facebook post and I was like, I'm looking for a publisher. And this lady is Akia Martin. She reached out. She was like, hey, hook up with Renetta Gunn Stevens. And there was my publisher. And she called me and she was like, LaTonya, let's do it. And in 48 days, we took the content from what Kelcher had put together and compiled it into the book. And I had my birthday book. I set a deadline. I said, I'm going to have a book by my birthday, July 24th. And it came out in August. So I'm telling you, you can do it. Everything that you post to Instagram, just put all that content. Keep writing. See what's resonating with your clients, with who's engaging on your page, and put it together in a file, and work with the publisher and put it out there. And now the book is in Walmart, Barnes and Noble, Books A Million, and of course I have it on my website, because you make more money, if you keep it on your website. So definitely get a spot on your website for it. But you can do it.
Yeah, and drop your website.
Yeah, so the website, www.latonyabynum.com. Yes.
Okay, great. And that'll be in the show notes. So before we go on to your second book, tell us about the app that you have.
Yeah, so the app came as a result of the CHES exam study sessions that I started doing in 2017. So a nice lady, Miss Debbie, reached out to me. She was a nurse. She was like, LaTonya, I'm thinking like a nurse. I want to take the CHES exam. I don't know what to do. So can you kind of train me? And I was like, okay. She was like, I'll pay you. And I was like, really? And at that time, I was like, I'm not into this. This is not what I do. And I told her, I said, well, actually, I failed it the first time. She was like, no, you are a health educator. It's 2017. I've been having the CHES certification since 2011. And she paid me $50 to train her for 2 hours. And I was like, okay, well, I'm going to do this with you. Do you mind me also inviting a couple others? So I got 4 other ladies to join in on our call, all pay me $50. And I said, well, let's just go through this training. So I walked them through some practice exam questions. And what I was noticing was I kept saying the same thing over and over. So I did it that one session. They all passed, 100% passed. So that was good. Then I did another session. Some people only listened to the study session, but I started doing homework with them because I felt like they needed more mentorship on how to apply some of the terminology. So the CHES exam study app really came out of my work on trying to get people to apply the terminology quicker, and then also master it, and then go through some practice questions on their own so that they can gain confidence. So the CHES exam study app is on Android and also Apple phones for users to download free, no cost.
Awesome. And did you develop that completely by yourself, or did you get some help along the way?
Yeah, so I have an app developer. Once again, LinkedIn, I put a message out there and said, hey, I'm looking for a app developer. And a young man out of India, Ankit Parmar, he reached out to me. He was like, hey, I can help with that. But I got so much attention from that post. But the only thing he did differently was he emailed me. That everybody else was inboxing me in LinkedIn. I was like, there's too many messages, and they all got lost. But he reached out, sent his information and some samples, and I called him, and he was like, I can help with that. So we worked on the Android version first, and then we transitioned into the Apple version in 2017, 2018. We got the Apple version going. So, but so far the feedback has been awesome. Everybody's like, oh my God, this app is wonderful. LaTonya, thank you for doing this. And, I passed. That's all I want to hear. I passed. And the whole point of it is I don't want people to have to spend money that I had to spend twice trying to pass the exam, all because they didn't have a guided study pattern. Nobody to really mentor them and say, hey, if you study these terms, you'll be on track to pass. So that's what the app is doing.
Okay, that's great. And that's a testament to just reaching out, and then people will reach out to you. And then on the other side, like, show that you actually want it more than others. Go a step further, go to the email and not just LinkedIn. And that's how you picture a developer. So that's
Mm-hmm.
awesome. Thanks for
Mm-hmm.
sharing that. So
Mm-hmm.
next is your next up and coming book. I would let you
Yes.
introduce it.
Yeah, so it's called Mind Your Business. Are You Okay? And it's really it came out of just COVID-19, really just slowing down, relaxing, and kind of looking back and doing a lot of soul searching. But what I found was, in order to apply the first book, Tools for Career Success, you really have to have a mindset of, I'm going to be fearless. I'm not going to get comfortable. I'm going to take some risk in changing and innovating public health. So I think for 3 years, it took some time for me to kind of shift my mindset on, a lot of people say in Arkansas, you're doing too much. You just need to sit down somewhere, or, just, maintain status quo. They don't say that, but it's like, don't be oddball out. And I've always been like that weird one
Mhm.
in any bunch that I'm in. But I found that through this book, I'm really saying, really mind your business two ways. One is focus on developing strategies to address your own problems. And then two, because you've addressed your own problems and mastered some of your own problems, you can take those same strategies and techniques and help other people, especially, in public service. And I think it's a myth that public health folks don't need help. We have lives, we have family, and so many challenges ourselves. And I think if we take that time to really focus on ourselves and getting ourselves straight, we can help more people and mentor them to say, hey, I went through this, and look at me, I did it, why can't you do it? Here's my story. And people are starting to say, like, oh my God, I can't believe you went through that. You were a secretary, you're a book author now. Like, yeah, you can do it too. I'm telling you, you just got to push through. So this book is really like that mindset part of what you need to be that high performance public health professional.
Okay, okay, and I'll definitely look forward to reading it and reading the first book as well. Um,
Okay.
and
I have
and
to
as
send you copies of it.
Yeah, yeah, definitely. I won't send you my address now just because I don't know if I'll be here next month. But
Gotcha.
when I
Yeah.
move to my next location, I will definitely send it.
Okay.
Like get you in contact with that. So
Okay.
moving on, what public health issue resonates most with you and why?
The public health issue that resonates with me the most would be health disparities. You know, when I was at the health department, I would look at data. I don't know if you've ever heard of the behavioral risk factor surveillance system.
Yeah.
Yes, CDC survey. So it's adult health survey, phone and also cell phone, and also um, landline phone. But just listening to some of the interviews and looking at the data, doing reports, I always looked at it like, I wish I could tell people, like, the data, these are real people with real lives. These are loved ones. It's not just the numbers. These are human lives. So when I was listening in on the phone conversations, I could hear like people telling their stories. And so just listening in, being the birthers coordinator, and also analyzing the data and then going into distributing the reports, I'm like, I see the health disparities and I know why that occurs. And most times it's because people don't have the same access, or they're actually it's just something in their culture, like they just do things a certain way. That's just how they were raised. So with health disparities, it really has been something that I've been interested in. I published on it, working with Dr. Apatharu Balamarugan at the health department. He took me under his wing and helped me to develop four co-authored papers. And then once I finished with my master's in public health, we published a depression paper where I served as first author. But health disparities has been something I've been passionate about for a while. And that same health disparities platform that I was sharing at the health department, I'm actually working on that through my own business. And I always tell folks when I'm doing resumes, writing resumes, I'm looking at economic stability, so if I can give people better jobs, higher paying jobs, also quality jobs where they can showcase their values, strengths, and also work towards their purpose, calling, their mission on earth, I feel like it is stabilizing their household living, how much they're bringing into their household. And then also they're giving them a better quality of life because, we all need money to live. So, and I always think of like this, in public health, we give so much, and we're expected to be like not paid well. But I feel like if we're making a difference, and then we're also at that point where we can help others, we are doing the best that we can. So I just really have benefited from just learning from the data and then taking that and putting that whole understanding in my own business to help my clients.
Yeah, and that's huge. Health disparities are a huge problem, and you can see them in very systematic ways. So thank you for talking about that, and hopefully we can make a bigger impact in that. And I know DEI, diversity, equity, and inclusion is a huge topic in like the public health world now. So hopefully, especially as a lot of health disparities and health inequities are coming out because of COVID, hopefully we can start those conversations and actually work towards solving those issues more now than ever, as we need it now. But yeah, and economic stability is something that a lot of people don't think about that goes into health, and it's a huge factor going into health. Like, interestingly, the person who has more education and has a longer life expectancy, although it shouldn't be that way, that is the way it is. So definitely getting those opportunities to have those things are very important.
Yeah. And there's even data to show where if you live in certain neighborhoods, they can determine your life expectancy. And so, that's access to healthcare, access to, quality jobs. So everything is tied up. And we could get, talk more and more about, I think it's so important to look at how people are living, economically. If you're not doing good, then how can you have a quality of life as far as, if you look at your finances? And so, I feel like I'm doing great public health, much needed public health work by helping people with their resumes and saying, hey, you were a cashier, you need to put that on your resume. Like, just because you're in public health, because it's all tied together. If you were a cashier, you were also doing customer service. You had to know the store policies and procedures. So there's so much tied up into some of these retail jobs that I see because I've done that retail side. There's also that community engagement piece, because if you can be a good cashier and talk to all these folks, you can engage the community. So it's just all working out. So far, I've helped over 400 clients with their resumes. I've done so much work in resumes. I feel like now it's almost like I'm identifying people's gifts and callings. So I'm like doing resumes to help people get jobs now. I'm looking at it like, did you know you can start a business using this skill right here? Did you know you can get a federal contract? Like, look at me. So it's starting to take a life of its own, the work that I'm doing.
Yeah, definitely. And just learning about those different opportunities. Like, if you don't know about contracts or starting your business or setting up an LLC, or just knowing that it's possible for something, a skill that you have, it is very hard. And I think it's very important to understand that you do get valuable skills from other jobs outside of public health that are easily transferable into public health. It's just about abstract getting that value and really showcasing it on your resume. So thank you for sharing that. Yeah. So where would you like to see yourself in the future?
So after Keltra graduated from her program and the internship ended, I said I need to find 40, 50 more Keltras. So I was able to pick up 3 additional interns and also 28 mentees. And so I said to myself, I want to like all of the energy and the passion that I have for public health, I want to infuse that into other public health, emerging public health professionals to let them know that, hey, there's a different way. You don't have to just look at it like just get a job. I'm really big on like everybody needs at least 7 streams of income. And I feel like if we all had 7 streams of income, public health will work out so much better because you're able to tell the truth about your feelings. You're able to speak up in meetings because you're not so pigeonholed to say, hey, I can't say that because this is my only job. It just allows you to be more open and you can be yourself. So my next level is really to build more leadership capacity within my organization so that I have a point of contact person for some of these major contracts. I recently got into federal contracting and got my registration. I'm also working on small business association certifications so that I can get some of these government set aside contracts. But as I get into doing more, I'm building my team. So I'm hoping that I'm able to delegate responsibly, but then also help other people who are working beside me to see that they could do some of this work. Because it is just so much work, to be honest. It's so much work to be done. So I see myself just showing people ways to access some of the resources that I've been able to access and then give them the tools so that they can be successful and they don't have to go through some of the pitfalls that I've experienced in my career and then also in my business, just learning curves.
Yeah, and I appreciate what you're saying there because you definitely taught me a lot of things through your social media posts on LinkedIn and Instagram. So I definitely appreciate that. Would you like to dive a little deeper into the mentorship that you do?
Okay. Yeah, so mentorship. So I have a internship and mentorship program really working in conjunction I've had 4 mentors, 28 mentees currently. But I think, mentorship to me it's not about me telling people what to do. We're really learning and sharing with each other. And what I'm finding is a lot of these younger students, they're very innovative, very curious millennials, public health millennials. They're very curious, creative. I had this one young man, Jesus Medrano Palacios. He came to me. I was in Texas, Commerce, Texas, doing a speaking engagement. He said, "Hey, I want to be your intern." I was like, "Okay," and that was right when I was working with Kelter. So I was like, "I don't know," but he reached out to me a year later. We connected. It has been amazing. My website, he has developed it out. We've created Educate Yourself program. We have an international visa program. Like, it's just, man, I done lost my track on what I was trying to say. But mentorship, I feel like infusing what I'm passionate about, showing and directing students a new way of learning, but then also letting them know I'm trying to learn some from them too. And with Jesus and all of my mentors, mentees, and interns, always in my conversation after I feel like I've poured out so much, I always ask them, tell me 3 aha moments from this conversation. Because I'm trying to get that feedback on, I'm giving you so much. Can you give me something back? Like, what was valuable? And oftentimes they will say, "Listen, I never thought of it like that, but what you're saying, this is right." So that's the kind of stuff that I'll go and I'll post on social media. Like, okay, if that was a nugget for them, they didn't know it. I didn't know I was giving it to them. Let me get this to everybody else who's following me. And it's a constant feed all day. So
Okay.
oftentimes my husband will tell me to go sit down somewhere. I'm doing too much. Yeah. So, but yeah, mentorship, I think, just empowering young minds to assure them that you can do so much. And we need leaders to step up. We need new leadership.
Yeah, absolutely. And what about the internship? What do the interns typically do?
Yeah, so the internship is really focused. I try to give interns projects that they want to work on, because I remember in my master's program, I was given an assignment, depression, and I really like that wasn't my topic, but come to find out, it actually helped my personal life, but then just giving me a platform to talk about, we need to connect the head to the body, because sometimes you're telling folks eat healthy, exercise, walk, but you don't know, like they have some things going on in their mind that won't allow them to get physically fit or healthier. So you really need to focus on that mindset and, look in their emotional support system. So, but that's a whole nother story. But with the interns, the 3 interns that I had, I really worked with them on projects that they wanted to do. One young lady did high blood pressure, hypertension. Another young lady looked at depression. And then the young man, he looked at diabetes. And so just taking their ideas and developing out a program or a toolkit of their own. That was the purpose of the internship. And just me constantly pouring into them, and then them also giving back to me, and just learning more about the way they're thinking of things and how it could work.
Okay, so it's more of like a health education internship where
they're all health education background specialties.
Okay, so they bring their interests and then you walk them through setting up programs that can benefit whatever their interests are.
Yes.
Okay,
you're exactly
that's awesome.
Right.
Okay, that's great. So tell us about your biggest failure that you've had in your public health career.
The biggest failure that I've had, that's a good question. Let me think. I've had a lot of them.
That's good. If you fail big, you go big, you get bigger, so it's okay.
Yeah, I think, okay, so this is one that really got me. And I want to talk about this one because it's the only one that ended in tears. And I actually wrote about it in my book. But so many times, I don't know about you, but I would get caught up with this ego thing, thinking, oh, I'm smart, I got a degree, like people need to listen to me, especially these older people at the health department. They used to just listen to what I got to say. I got the new way of thinking. And I was just on this kick about, just change. We need to change. But I really didn't realize that change takes time, and you have to get people to buy into change. And so I had worked on some fact sheet, and we presented it to what we call a science advisory committee. And one of the leaders, he was like, "This is garbage." And I said, "Oh my God." So I took it personal and was like, he's saying I'm garbage, not the fact sheet, but me. And so I really took it personal, and I went back to my office. I was crying, and everybody was like, just go home. So I went home. But years later, I had joined 2016, 2014. I had joined ToastMasters, and looking back on that, I really didn't think of it about it like this. It was constructive criticism, but I couldn't take it then because I was so tied up into my career. Like, I am my title. I am a public health leader. And if you say something's wrong with my document, then you're basically talking about me and my education and whoever I am. But what he was trying to say is, this is not my best work. Go back and look at the data. And I went back and looked at it. I was wrong. But that's the point of leadership and grooming and having mentors. Some mentors, like they're very aggressive, assertive. And my approach, the way I lead, is I like to tell you a personal story of how, how something has happened to me and why I'm saying it. So I'm more, I'm explaining things rather than saying, you need to do this, because that's what I've experienced. And so I would think my biggest failure is not being able to take constructive criticism, but becoming a Toastmaster helped me to sift through, listen to conversations, also, take the good and the bad and just pick the good that I want to choose and change from. But I would say my biggest public health failure is having such a high ego and then actually getting that deflated and running off and being able to reflect on things that I could have done better. And I think that has helped me in so many ways with my business, with my leadership, and also grooming new leaders. It's about meeting and connecting with people where they are, you know?
Mm-hmm.
So I would say that's a failure, but now it's turned into one of my biggest achievements.
Yeah.
You know?
Yeah, definitely. No, and I've had a similar situation with one of my internships. Like I was writing reports, and my preceptor was like, "This is horrible," and like she didn't mean it in a bad way. She
No.
it definitely hurt, but like I took that, and I took from that I should be presenting my work better. I need to learn, and then my writing has been a lot better since then. So
See there?
just have to take it in the right way. But I definitely understand, like, some people leadership styles probably don't mesh with how you feel, and it might come across a certain way. But definitely not taking it personal, and really understanding that you are a person and your work is something different, and the work can always change. It can always change. So
That's
definitely have
right.
to learn that.
That's right. Yeah, don't get tied up. Yeah, you said that very well. Separate the professional from, it's not personal. They're just trying to get the right products out and make sure that the fact sheet is on point, because they can't have reports going out looking a mess or even incorrect. So yeah, that was a learning experience. But yeah, I do a lot of nurturing with my with my mentees and interns
Okay.
because of that experience.
Yeah, and I bet they appreciate that a lot.
Mm-hmm.
Okay,
Mm-hmm.
so we're gonna move on to the final section of the show, which is called
Okay.
the Furious Five.
Okay.
So I'm gonna ask you 5 questions. These are 5 questions that I'm gonna get asked to every guest.
Mm-hmm.
So, question number one: what advice would you give to a student trying to pursue a career in public health?
My best advice for any student pursuing a career in public health, I know when I graduated from high school, I remember the commencement speaker saying, find your passion and work at it, and you'll be successful. And so, I could appreciate that advice, but my new twist on that advice is, I tell all my clients is search by pay and not by title for public health, because I feel like, this is economic stability. I feel like if you focus on what you need to have a quality life, a quality living standard, how much your bills are and how much. Start with what you need on basics, and then feel free to reinvent yourself based on what you see that's a job description on I would recommend indeed.com. But being willing to be innovative and reinvent yourself, because a lot of these job titles, like me, I'm a technical editor, but actually I'm a health educator, so it just depends on where you're working and what that title might be. But if I was looking for jobs, I would never think technical editor. Like, that's something I need to look at. So I think the jobs are out there for us, but we have to be open-minded to say, guess what? We can serve in any setting, any industry, and take this public health thing and really apply it to these companies, whether it's healthcare, government, private practice, community, all of these, and also education systems. But it can be applied in any industry. So I want everybody to get more innovative about how you're looking at public health, because every company is trying to prevent loss, and
Mm-hmm.
so that's what we do in public health, is prevention. So you just have to be able to market your value and tell them, hey, this is what you need. You really need a public health leader on your team, and I am that, and you can do it. That's what I did. Yeah. So that's my best advice. Does that make
Mm-hmm.
sense? Search by
Yeah,
pay.
that absolutely makes sense, and I definitely agree with that. So moving on, number two, if you were talking to someone wanting to get into your position, what advice would you give them? So that's both technical writer and starting a business. That's
My best advice would be start with ToastMasters. I think you need to have thick skin. I work in private sector now. I would say, they're very profit driven. you get a lot of clients who want deliverables like quickly, so you get tied up into everything moving fast. Whereas when I worked at the government, it seems like things just took all year to kind of move through the stages. But my best advice would be to focus on something that is going to give more back to the agency that you're working for, and then also be something that is a transferable skill. Something that, so for instance, I worked as a health educator at the health department doing basically plain language, and I've taken that same skill and applied it to a private industry in tech, and working as working in plain language. So breaking down some of that business jargon into common language for the clients. So my best advice is just, look at the transferable skills, but just always know that there's two common transferable skills: communication and leadership.
Yeah.
It's Toastmasters really got me on communication and leadership. That's transferable through any job, any industry. I don't care where you're working at: business, technical editor, CEO of your own company. You gotta do an app, write a book. You're gonna need communication and leadership.
Yeah, and just in life too. Like you
Life.
need good communication and you need leadership to be successful, that's for sure.
Yes.
So what's something you are working on improving in your life right now?
Working on improving in my life right now. One thing I'm 38 now. I've been married for 13 years. And I always talk about this on my Facebook page, but I would say out of 13 years, this is the best year of my marriage. And I feel like just coming into my own, I feel like I've had to push through so many failures, and now it's not that I'm thriving, but I feel like I'm finally who I was meant to be. I'm finally working in my purpose. I'm finally doing things that I feel like, that makes me happy. And I'm starting to call it a public health high. When people call me and they're like, "Oh, LaTonya, something you wrote on your post, it really touched me, and I didn't have the words to say it, but everything you said was true. Oh my God, thank you so much." So I think just me resting in becoming myself, that has helped me to be a better businesswoman, a better mom, a better wife, a better leader. Just, I don't know. Just becoming more of who I was supposed to be. Something about responsibility. I don't know if this resonates with a student, but you go to school all of your life, then you got to get a job. Then after you get a job, people are like, "When you gonna get married?" Then you get married, then like, "When you gonna have kids?" And you get kids, you're like, "When you gonna retire?" So it's like stages and processes. I feel like now I'm finally doing things that I want to do at my own pace.
Yeah, I like that a lot.
Yeah.
And thank you for sharing the journey along the way to getting where you are now. And I definitely think just being happy and happiness in what you're doing is something that we don't talk about enough, and it's something that we definitely should. So question number 4, professionally, do you recommend anything? A book, a podcast, a group, YouTube, anything?
Professionally, let me think. So what I recommend, of course, ToastMasters International for communication and leadership. It just helps my whole life. Actually, ToastMasters has helped me to be a better wife. Just listening instead of just like going off, but just being a better communicator, listening, and also like evaluation skills, like listening, but then saying, basically, this is what I heard you say. Is that what you heard? I mean, is that what you said? So, let me think. Any book, podcast. You know what? This is what I want to say. When I was just getting into like feeling myself, if you will, in public health, really feeling like, oh, there's more opportunities out here. I don't have to work for the government all my life. I don't have to retire from the government. I started listening to Jim Rohn. He's a motivational speaker. I just started listening to all his YouTube podcasts and just listening to like he was all about personal development. He said, if you work on yourself personally, then you can have what you want. And so I said, well, if I do this personal work, then it'll spill over into my career. And so I really took some time to, work on self-development, training myself through train.org classes, taking grant writing, procurement, just management, communication, leadership classes. There's all kinds of classes in train.org, just getting those certificates and just, you got the degree, but it's like you have to still unlearn some of those bad habits and reprogram your brain for like what's needed here. How do I fill gaps in the department? And so I would say Jim Rowan is where I started. And then, so now that I'm into so many things all at once, I'm gonna be honest, I listen to a lot of Love Dorsey and also Nino Brown. Now that they have profanity in them, but I think in order to really, millennials will get it, because you need somebody to talk to your subconscious mind to say, hey, you can't do the same thing everybody's doing, but then you need that motivation to say, oh yeah, I can do it. So I listen to them when I really, when I was doing the app, developing 12 programs, I had all those mentors. That's who I listen to. Like, you know what? I'm the only one doing it, but it's okay. I'm gonna do it anyway. So, yeah, that's what I'm into.
Okay, definitely. And I definitely resonate with that. I'm someone who listens to a lot of like self-development, motivational like podcasts and stuff. So I definitely resonate with that. So the last question that I'm going to ask you today is, where can people connect with you?
Yes, so you can connect with me, of course, through my website, www.LaTonyaBynum.com. And of course, Sis Speaks Life on Instagram, on Facebook business, my Facebook business page, you are a resource. And then, of course, everyone should connect with me through LinkedIn. My challenge to everybody listening is get you a LinkedIn page. That's the best thing you can do for your career and also eventually for your business as well.
Thank you. And I completely agree. LinkedIn has definitely been something that I've leveraged to help improve my career and meet new connections. So yeah, thank you for the advice. And thank you for this amazing experience and story. And I definitely appreciate it. And I hope some of it resonates with the listeners. I will link to everything that you talk about in the podcast in the show notes. And I just like to say thank you so much again for being on the show. I really appreciate it.
You're welcome. Thank you for having me. If you ever need anything, just let me know. I really appreciate this opportunity, Amar.
Yeah, will do. Thank you. I'm so grateful that I got to have LaTonya on the show today. I hope that you all got some value from listening to her transition from secretary to health analyst at a health department. She definitely had a lot of value talking about how she went from that to starting her own business to working in contracting. And she's really a serial entrepreneur with her first book and her second book coming out and creating the CHES app. So definitely connect with her on LinkedIn and feel free to reach out to her. Definitely reached it this far in the episode. Thank you so much for listening. I really appreciate you taking your time to listen to these episodes. It is just me creating and editing it, so I really do appreciate you listening. And I hope that you stick around and you subscribe and review and give me some feedback so I can make this better. See you next time. Public Health Millennial out.